Nobody knows your body better than yourself, because when I had first lost eyesight, I went to the hospital and they said, no, go see the ophthalmologist. Results came up with nothing. Everything was fine. And they decided to do an MRI, and that's when they found out with the MRI.
So
that's from May to August.
Wow.
And then from August to December, I had to wait to do my second MRI before being confirmed that it was MS.
And what kind of treatments did they offer you?
They offered me case studies.
So right now you're taking Copaxone, is that correct?
Correct.
Did it do anything that you're sure of, or you just hope it did something?
I was never convinced that it did anything for me. I'm still having the symptoms, I'm still having the fatigue, I'm still having, other parts of me that are getting weaker and weaker, so I don't feel any help there from the Copaxone. They say there is, but there's no proof to what it is.
So she told me actually that the Doppler that was done in Canada didn't show any stenosis or blockages. Exactly. Is that correct?
Yeah. Stenosis of both jugular veins.
You found stenosis in both jugular veins?
And maybe stenosis of vein, azygos vein.
And how bad is the stenosis in the jugular vein?
Critical stenosis.
What are the symptoms of your MS?
My feet being frozen, looking at my toes to see if they're not blue, electric shocks in my head, numbness, definitely tiredness, weakness in my legs when doing exercises, and also walking around a lot. I'm affected the next day.
What was it about Dr. Zamboni that convinced you that this treatment is for you?
Just knowing that veins were blocked and my symptoms that I had with cold feet, I'm like, this is it. It's so true.
So
I was convinced.
So it's just sort of common sense, right?
It was common sense to what I was feeling, my symptoms that I was having had to do with that. It's not normal for a vein to be blocked.
So you being an MS patient, and the people that are paid to care for you make big money, right?
Definitely.
And they basically want to deny you this treatment in Canada. That's why you're in Bulgaria today, right?
Correct.
How do you feel about them forcing you to spend $10,000 or more of your money to come here? What's your feeling about that?
Towards people as doctors and all that, I think they have a protocol they have to follow, given no choice. I think it more has to do with the government. I just think they have to protect themselves because there's such a big law of protection out there.
Do you believe the law should be changed?
Definitely should be changed.
We had to go through our money that we have saved, some of it to be able to come here.
I don't have time to wait.
Why not?
I'm starting to feel it in my legs. I have 2 young kids. I don't have time.
And do you feel that they don't care about you and by making you wait?
Definitely.
Who do you think is standing in the way of making this treatment available in the United States and in Canada?
Like those big companies, they have a lot to lose. So if they are able to slow down this, because if you look at the treatment, it's not like you're not gonna take drugs, you're not gonna take anything. It's just like they deblock that vein and after that you feel better. If it gives you like a year, 2 year, 5 year of well-being, I think it's worth it, even if it's a month.
These are people that are receiving donations off the street from people who are supporting them, people who are doing walks, and they're not even helping us in that part, which is disgusting.
Why do you feel safe about this procedure?
I don't think it's a high-risk procedure. We see how it goes, and I don't think that this is the part where I feel safe about it. It's they do same type of procedure in Canada when you have heart problems.
My best hope is that it stops, that everything that has been damaged is able to repair itself, since I'm not that far advanced with a lot of, compared to other MS patients, and to be able to continue living a healthy life.